Hey guys, hope everybody's having a good day. I wanted to come on here quick today and talk about scarring. And I have my patient here that we're going to talk about. Say hi, Trev.
Hi.
Yeah. So this is going back to my scaphoid wrist fracture. This is a continuation of everything. I'm just going to kind of chronicle what goes on with him so people can kind of learn a little bit. So his glue came off that he had internal stitches, and then the doc put glue on him. So we didn't actually have to do suture removal, which I was kind of bummed about because I love to take out stitches. But actually, for those of you that don't know me, my name's Heather. I'm a certified hand therapist and occupational therapist, and I own Healing Hands Therapy Center down in Collinsville. So I take care of hands, wrists, elbows, and shoulders. And I also specialize in working with musicians. But right now we're talking scars and the importance of making sure you do really good scar management. It is crucial because especially in the hand and the wrist, you can tell there's not a lot of mass. Everything is very close to the surface. So anytime you have any kind of surgical intervention, scarring can happen. And some people will scar more than others. A lot of people have probably heard of keloid scars. You don't have to have necessarily a keloid scar to have the scar adhere to the tendons underneath. And then what happens is when the scar adheres to the tendon underneath, it gets sticky, and then you limit your actual mobility. So the best thing to deal with scar and to help monitor and get rid of scar is motion. That's one of the big things. Another thing is a scar pad, and I'm going to kind of make one of those actually right now. I know there's some stuff that you can buy in the drugstores and that kind of thing. I've never personally used them, so I don't know. I have a little mixture that I make. It's two substances. It's called Elastomere, and then there's also silicone gel sleeves that I will tend to use as well, which I find super effective. And they just help to take the redness away and soften the scar. And I usually have patients wear them at night and then take them off during the day so that they can do scar massage and that kind of thing in range of motion. Scar massage is another key thing that you really want to make sure that you do. Yeah, you obviously want to make sure that the stitches are out and the wound is completely closed before you go rubbing and digging. Obviously, you don't want to pull your scar apart, which is, a fear of everybody. And then you can get a little bit more aggressive as time goes on. Now, with certain diagnoses, you're not allowed to do active motion right away, like with a tendon repair and that kind of thing, depending on the doctor's protocol. So you have to work with your therapist to make sure that what you're doing is within the guidelines of the protocol that you're actually using. But it's really, really important to get rid of that scarring, because one of the things that's actually limiting Trevor right now in his wrist flexion is scarring and tendon shortening. So he was immobilized for a very short period of time. He was only immobilized for 2 weeks in the cast and then a week with a dressing, right? Gosh, I forget already. And he's already pretty limited. So if you could only imagine if you're in a cast for even longer than that, how tight you're going to be. So our tendons and our tissues do a wonderful job at adapting and shortening. So when you tell it not to move by being in a cast and immobilizing it, it's going to say, okay, and it shortens. Everything shortens. So your ligaments shorten, your tendon length, muscle length shortens, all that fun stuff. So it's important to kind of re-stretch things out. And it doesn't like to stretch as easily as it likes to shorten. So one of the scar massage. Give me your wrist there, buddy. Yeah, he's thrilled to be doing this. So he's got a beautiful looking scar. The glue just came off last night because he didn't really want to peel it off. And he actually has a little internal stitch right here that's trying to come out a little bit. So we're going to monitor that as well. But that doesn't stop us from doing our scar massage. So when I do scar massage with him, I just sort of take my finger and I rub along the scar. And I give him a little bit of pressure, and he's better at this than he was in the beginning. He didn't like it in the beginning, right? So I go circles, clockwise, counterclockwise. Yeah, he doesn't like that way. And then kind of up and down. And then I do this with his wrist in a nice straight position, and then his most limited motion is actually bending down, which is much better than it was. And then I'll do it and I stretch it as well. Look at it, he's so funny. Isn't he cute? He's gonna roll his eyes at me. Look at it, he's like that. The other thing with scars, actually, well, I remember so I don't forget, is sometimes they get very hypersensitive. So it's really super important. I'm going to steal this towel. Oops, and it makes my phone fall down. Sorry, guys. Is to do something called desensitization. So give me both of your arms there, buddy. All right. So scars can get very hypersensitive afterwards. All right. So what you're going to do is you take different textures, and I'm just going to grab a towel because it's what I have right here. And you rub the towel and the texture on the non-involved side. So I'm rubbing it on his right wrist. So it sends a signal to his brain of what it should feel like. So you feel what that should feel like? Yeah. And now I'm going to come and I'm going to rub it over here. Does it feel the same or different?
Pretty much the same.
Feels the same for him. So that's good. So he's not hypersensitive, but he is a little bit when I poke on him. But so textures, he's not hypersensitive, but a lot of people, what will happen is they'll take this texture and they'll rub it over here and it'll feel completely and utterly different. So it's important to normalize the nervous system and rub it on the other side that's not involved, and then take it on this side and rub it on this side. Some people will actually get a little nauseous because it is so sensitive and they react physically to that hypersensitivity. But it's important to do that throughout the day multiple times with lots of different textures if you do have hypersensitivity of that scar. And if you just leave it alone and don't touch it because it is hypersensitive, it will get worse rather than better. So that's just something to keep in mind. So if I were to stretch him and do scar massage, back to scar massage, we're just going to kind of rub in all different directions. All right. And then not just over the line, you want to go below and then also above that area. All right. So I'm going to make him this cool wall. I'll actually just show you quick. So this is the scar pad, and this is called Scar Therapy Gel Care. These are kind of expensive, but what you can kind of see, it's actually a self-adherent thing. And it will stick to his scar. So I'll probably cut him a piece of this as well, but I'm going to make him a scar pad because I like the elastomer better. I find that it just works a lot better than the silicone does. That's my personal feeling about it. I'm sure other people will think differently, and that's okay. It's just a matter. So what you do with this is there's two different types. It's like chemistry class, right, buddy? So there's two different colors. I take a little bit out and then I mix them together. And it will not get really hard, but it will get firmer. And the key with this is you wear it at night when you go to bed. You can wear it during the day, but it kind of gets in the way of things and of life and of swimming, right? If you had to wear this during the day, it would get in the way of swimming. So, and then the other thing you want to make sure of as I do this is that when you go out in the sun, that you make sure that you keep your scar covered either with clothing or with sunscreen, because scars will get darker and more permanent if the sun gets to them. So this is a scar pad. So what I do is I just sort of mold it to him right over his incision. And then we let it dry and harden a little bit, and then you'll actually be able to see the incision line in there. So I think that's all things scars for today. I'm going to go ahead and torture him so we can get some more wrist flexion. And if anybody has questions, please comment below. Talk to you soon. Bye. Say bye.
Bye.